Well, good afternoon. The Thinking Medic here. And in today's post of hashtag not baking cakes, I'm at the beach, yes, as you can see by the backdrop. I figured we'd talk about diabetics. Now, diabetics are something that is a general population or kind of near and dear to my heart. My father had diabetes, and it was what ultimately the underlying cause of his very untimely death, going to be 5 years. And so when it comes to diabetics, I kind of have a soft spot in my heart for them, so to speak. And so we all have that one in our first response area that we get the call at least once a month, right? And diabetic Dan let his sugars get low, and we show up at 3 in the morning and we try to give him oral glucose and he fights us. And so we start a large bore IV in the AC and we dump him full of D50 and, send his sugar through the roof. Then we make him a peanut butter sandwich and get the refusal, and then we get on our way. And I'm here to tell you that's a pretty shitty way to be a patient care provider. And so what I would recommend the next time that you're there is give the guy a full assessment, or gal. Have them take their socks off, check their feet. With neuropathy and the disease process and how easily it is for them to get a blister and stub their toe, and then all of a sudden they got an infection in their foot, right? And then they don't heal well, and then they get septic, and then they're dead. Or one of any multitude of things. And so I recommend just maybe do a full assessment on them. Ask them when the last time they saw their doc was. When was the last time they had a physical? When was the last time they had their insulin scales checked? When was the last time they actually went and saw their endocrinologist? I mean, it's just about caring about patients, not just doing patient care and going through the motions. Because really, if you're just going to go through the motions, anybody can do your job. You're not anything special. What's special is taking people with a sense of dignity, treating them with a sense of dignity, and treating them like they're human beings. And so that's really what this is about, is don't just follow the protocol and bake that cake and run them through the recipe and give them the D50 and give them the peanut butter sandwich and you're on your way. Actually take care of your patients. Make a difference. Not every patient's going to make a difference to you, but you might be the one that makes a difference to them. So anyway, that's my 2 cents for today. Not baking cakes. I love it. Not baking cakes is taking off, man. This is great. So I love it. I love that the positive responses that I'm getting from folks and talking about this, and the way that it's changing patient care, just in small ways. I think that's so cool, and it keeps me motivated to want to be better too. So thank you for that. But anyway, we'll see you again this week. I'll keep doing vids. Probably be at the beach most of the time. So hashtag no regrets, right? Hashtag. All right. Hey, you guys be safe. Thank you so much for watching. What you do is just amazing. So thank you so much for what you do. And we'll see you when you see me again at thinkinmedic.com.